Okay, so we've got some quick fire, non-clinical top tips for you to whiz through. First of all, temperature. Both St James and LGI are like saunas over the summer, so just be prepared and dress appropriately. Getting to work. Car parks, they're currently both free, the multi-storey at St James's and LGI, the barriers are up all the time. When the pandemic's over, you just pay £30 a month. It automatically comes out of your paycheck and you can use it 24 hours. If you're more active and you want to cycle or walk to work, at LGI there are secured bike locks with a code and cage at the back entrance to Jubilee Wing by the Boots, and there are just freestanding bike racks by the main Jubilee Wing entrance. And at St James's, there's a secure bike lock in the multi-storey car park, and there are other smaller cages around Chancellor Wing and an open cage by Lincoln Wing. So there are bike racks around, you just need to find the codes, and there are various lockers and showers and towels around as well. So just ask, depending on which wing you're in, if that's how you want to get to work. There are a few apps I'd recommend downloading for your phone. So first of all, it's called the Induction app. You set it to the hospital you're in and you can use it as an online directory, so you can get the bleep numbers or the ward numbers of anyone you want to call. It saves you having to call the automated switchboard. If you do want to call the switchboard, in this trust you press 0 and you go through an operator. If you press 100 and it's automated, it's a disaster, so just call 0 and say who you want to speak to, or use the Induction app. The other good apps, there's one called Pando. It used to be called Forward. It's a trust secure app for showing, for discussing with different specialties, or sometimes sending photos to, say, dermatology. It's you can be confident with confidentiality and sending patient information within the hospital. The BNF app is fantastic. I definitely recommend at the start looking up all your doses, all your routes, all your maximum doses, and obviously the BNFC if you're starting in peds. The other app I'd recommend looking at is Pocket Doctor, and also the Rapid ebook. You'll have used it at uni, but it's got all the medical emergencies on there and their management. So I'd have those on your phone to use on the wards. Patient Pass is a new referral system online. It's mainly for neurology and neurosurgery, but also renal is starting to use it. Essentially, they don't want you to call them for advice and guidelines. They want you to put it all on this online referral system. You need to set up an own account with your NHS email address and a password. You refer patients online that way and they respond to you. Obviously, if it's an acutely unwell patient, they will just say, call us, but for everything else that's not life-threatening, you put it online. I also want to mention the critical care outreach team. These are all very senior sisters with ICU experience who you can bleep, and they will come and help review a deteriorating patient with you. You can normally get help from your other SHO colleagues or your registrar, but if you can't, or you just want someone else to physically be there to review a patient with you, call critical care outreach, and they're also fantastic at liaising with ICU if the patient's suitable to be transferred to ICU. So that's just a reminder that you are never alone with an unwell patient. There is always someone from your team, or if not, the critical care outreach team. The Trust intranet is fantastic. It has all the guidelines you could ever want on there and lots of information about referring. It can be tricky to navigate, so just try and get used to it and get one of the other F1s to show you on this when you start work how to navigate it. But the guidelines are there when you know where to find them. You have to be on a Trust computer to find it. Sadly, you can't get it from home. But essentially, whatever the condition is, if you follow the Trust guidelines and you've documented, I've followed the Trust guidelines, you cannot go wrong and you cannot get into trouble. So it really can be your friend, the intranet. You'll all already have or be getting an nhs.net email address. Make sure you know your password and make sure it's downloaded onto your phone. You will get regular communications about PPE, about COVID, about supervisor meetings, and you look like a real dummy if you're not checking your emails regularly. So get it on your phone so you can stay up to date. Also, if you're emailing from an nhs.net to an nhs.net email, that is secure. You can send patient information and that is within information governance. Anything outside that, using a doctors.net, using anything else is not secure. So just as a rule of thumb, always use your nhs.net email address. Speaking about confidentiality, just be really mindful when and how you're talking about patients. It's very exciting that you're responsible for patients and that you're starting work, but just be careful. Even within the hospital, there are lots of non-clinical people and lots of family and relatives, so just be mindful what you're talking about. Don't get into trouble and don't break confidentiality. Consultant coffee. Consultants will offer you a coffee. Don't be polite and say no. Say yes. You'll need the caffeine. You'll want a little pick-me-up, so just say yes. The standard F1 answer is for either a latte or a flat white. Pockets are quite important. You will have a bleep on you. You will have a handover list. You'll have a jobs list. You'll have pens, all sorts. Just have pockets so you don't leave it lying around the hospital or don't lose it and break all sorts of GMC guidelines. So just wear pockets. Okay, communication is key. And I believe most mistakes happen and also most altercations happen when there's miscommunication. For every patient, I'd follow the S-bar. If you say, I've got an 80-year-old lady, I'm concerned she's having an intracranial bleed, even the snootiest neurosurgeon will listen to you and will come and review that patient for you. If you start waffling about their background, the medication they're taking, their social history, they will switch off and they might miss the important information. So have a pithy opening line for the situation and background and communicate clearly with the S-bar, and it will save you a lot of hassle and it will save a lot of aggravation from the other side. When referring to a specialty or asking for advice, just be prepared. Be mindful that if you're calling a specialty, you'll likely be speaking to their registrar. So just respect that this is a senior doctor you're speaking to, so have all the information they'll need. If you're speaking to cardiology, make sure you've got their ECGs, make sure you've got their blood results. Just be prepared so that when they ask all the questions, you've got the information. Have PPM Plus up open in front of you and have their paper notes as well. And also make sure you have personally reviewed that patient yourself. Communicating with patients and their relatives will be a large part of your job as an F1, and it's a part that you might not have had much exposure to during medical school. Just make sure if you are going to speak to a patient or their relatives, you are prepared for that conversation and you personally feel confident giving that information. I think senior doctors can sometimes forget how junior we are and ask us to have a conversation that we're not actually confident doing. We don't have all the information, we don't know, we're not able to answer their questions. So just make sure you feel prepared. I'd say for the first few, I'd observe another doctor doing it first, and then when you feel confident, you can go ahead and lead those conversations yourself. But just if you're not happy having those conversations, that's completely fine, and no one will judge you or mind if you say, I don't feel able to have this conversation. So finally, I wanted to mention your portfolio, because it baffled a lot of us at the start of our jobs. Nobody likes it, but everybody has to get on with it, and you'll have a portfolio to do every year for the rest of your career. It's a website called Horus. You'll be given a log on. I'd say as soon as you can get a log on, start building up your portfolio, because it can just make it easier when it comes to the end of the year if you get started earlier. So essentially, you'll be given a few supervisors over the course of the year. You'll be given one educational supervisor for the year, and you'll be given 3 clinical supervisors, 1 for each job, and they'll work in that department that you're in. It's your responsibility to meet with them at the start and end of each job, and it's their responsibility to sign you off to say that you've passed that job and overall you've passed that year. Those meetings can be quite informal, but they do count for a lot, and it is the difference between passing the year and failing. There are several skills you have to get signed off. The mini KEXs is an observed interaction with a patient. It could be clerking a patient, it could be certifying a patient's death, it could be anything along the filling in a respect form. Anything that a senior can see you do and discuss with you counts as a mini KEX, and you need to do 2 or 3 of those per job. ADOPS, just like in medical school, is an observed procedure. So it could be inserting an NG tube, it could be donning and doffing for PPE, anything like that counts as ADOPS, and you have to do 0 to 1 per job. Core procedures, there are 15 to get through in the year. They're all things you'd be doing every day, you just need to get someone to see you doing them to get them signed off. For these, nurses are your friends because lots of them are intramuscular injections or catheterizations, so just get them signed off before the end of the year. And if you can, start getting them signed off now during this period. A case-based discussion is very much what it sounds. You pick a case that you've seen and been involved with and you discuss it with either a registrar or a consultant. Be prepared to have done a bit of homework about that case so you can discuss it in detail. And reflections. I'm not a very reflective person, so this was very painful. You have to do 18 reflections a year, which I think is an awful lot. These can be about anything. They can be about mandatory training days. They can be about starting work, seeing a COVID patient. They can be about literally anything. You just have to have something reflective to say about each one and upload it onto your portfolio. And finally, you have to do one, developing the clinical teacher. You have to do some form of teaching to either your department or medical students or literally anybody and get it signed off. So the portfolio's a GMC requirement, but it can be a bit of a nightmare if you leave it to the last minute. So just stay on top of it for each job, and if you can, start it early. If you've got any questions, just email us. Our email addresses are on our first slide, but just ask anything you want.